Welcome to MRC Unit The Gambia at London School of Hygiene and Tropical Medicine. This is the Clinical Services Department. If you have come here today for the first time, then you will be seen first by a nurse in the Gate Clinic. This clinic starts very early in the morning and allows the general public to access our services. You will be seen by a nurse who will listen to you, make an initial diagnosis, and provide you with the right treatment. If the nurse is not sure of the diagnosis or if you have signs of serious illness, you may be referred to see a doctor in our outpatient department. The outpatient department has 4 doctors on duty. The doctor who sees you will have access to any previous records of previous appointments you have had at MRC. The doctor will listen to you, examine your body, arrange any necessary tests, and provide you with treatment. If you are asked to come back another day to see the doctor, you should arrive at the clinic by 8 in the morning. Patients are usually seen in order of arrival. However, staff are told to prioritize patients who are acutely unwell. Different doctors have different specialties, so it is possible that someone who came after you might be called in first. If you need some tests, you will need to go to the medical imaging department or to the laboratory. Although blood samples are taken in one room, there are many different tests that we do on your blood, and samples may be analyzed in 5 different laboratories. So we may need a few small bottles of blood to fully understand your illness. Once your condition has stabilized, you may be asked to go to another clinic for ongoing care. This is because our expertise is in making difficult diagnoses and treating complicated conditions. We need to free up space in the clinic for those who need our specialist skills. If the doctor thinks you will benefit from admission to the ward, they will arrange this. If you are admitted to the ward, you will need an escort to accompany you throughout your stay. You will need to provide a spoon and a cup. We will provide food and bedding. Please do not put anything other than water down the sinks. The staff on the ward will help you understand what is happening during your admission. Please feel free to ask questions if you are unsure about anything. If you have a problem that affects your blood, your liver, or your kidneys, we sometimes need to send blood samples to the laboratory several days running so that we can see if things are improving or not. This clinic is funded by the Medical Research Council of the UK as a service to the Gambian people. However, in order to help us care for more people in both the Gate Clinic and the outpatient department, adult patients will need to pay a small contribution towards the cost of tests and drugs. Older children also pay something towards the cost of their drugs. Adults admitted to the ward pay a very small weekly admission fee. All fees should be paid to the cashier and you will receive an official printed MRC receipt. The only exception of this is if you leave the ward at the weekend. Then the senior nurse will collect your fees and give you a handwritten receipt. If you are asked to pay money to anyone else, or if you are not given a receipt, please report this to a member of staff. We do not provide an emergency service at our clinic. If you are suddenly taken ill and the illness is severe, then we recommend that you go to another health facility rather than wait here until the next morning. The nearest hospital is Scanifing General Hospital. MRC Unit The Gambia at London School of Hygiene and Tropical Medicine seeks to study illnesses and treatments in the Gambia so that the Gambian people and others in Africa can receive better medical care. We keep your medical records in a computer database. We can take the information from the database without it being linked to your name or identity. Sometimes we use the information in this format to better understand how illnesses behave in this setting or to improve the quality of care we provide in this clinic. When we use the information to answer research questions, We always get prior permission from the Gambian government MRC Joint Ethics Committee. If you have any questions about this, please ask a member of staff. If you don't want your information to be included in this research, you can also tell a member of staff who will ensure it is excluded. This will not have any effect on the care you are given. Today, I hope you find that you are treated politely, listened to, and given the right treatment for your problem. We are sorry that you may have to wait a long time, but this helps us to keep the cost of our services very low. If at any stage you have any questions or concerns, please let a member of our staff know.